Hi, this is G.H. Glade for Coaching ADD in the Stimulus-Driven Brain. Well, I have a podcast I listen to a whole lot. It's a really good podcast. It's called The Jason Harbinger Show. And I encourage people to take a look at this. And I'll have a reference to this in the show notes. And he has a feedback section where he details his own experience with medication and ADD. And I'm going to do a deeper dive on your worst fears about taking stimulant medications in future videos. Because, you can see why he developed these worst fears that everybody worries about. And he tells a story about how he was in college. He notes how he took his girlfriend's Adderall and how he had really what sounds like a really good response. And so he went into what I assume was, a school-based health clinic and whatnot. And the doctor there prescribed him a prescription based on his report of, hey, I did really well on Adderall. Apparently, according to Mr. Harbinger's sort of description of this, he wrote him a prescription with absolutely no assessment. Then he came running after him and said, he basically urged him not to take these things. These drugs kill people. And as I said, I'm going to be doing a deeper dive on all of this. But it really brought to, my mind the fact that many people don't know what an appropriate assessment for ADD entails. And it's really quite detailed. I sit on a review board for a major insurance company, and we have what is called a standard of care. And this particular doctor's was so far off a standard of care, he literally would have had his license sanctioned for doing that. So in this video, we're going to go through what is appropriate level of assessment for ADD. I start by what is a 90-minute interview. And in this interview, I want to accomplish quite a number of things. In the initial part, I want to look at what's the current complaint, what's going on. I want the person to flesh out the nuance of what is going on. For ADD, I want to look for patterns of behavior. And I want to make sure that we have reason to believe that this has been long-standing going back to childhood. The difficulty with ADD is there are many what are called comorbidities. Things like depression occurs much more frequently in people with ADD. Bipolar, 20%. It's a pretty high ratio of people. And literally, if you get this wrong and give the wrong person stimulants, you can kind of light them on fire. I know working in the emergency room of a major urban emergency room, I've taken care of those disasters because somebody didn't do that very basic initial assessment. You also want to assess anxiety. Anxiety is a common feature with ADD. OCD is something that you see more prevalent with people with ADD. So in this initial assessment portion, you're gaining lots and lots of information, and it's often allowing you to differentiate basically the ballpark of the interview. And that goes for any person coming in for any problem. And actually, it's identical with the assessment we did in the emergency room, albeit tailored to folks with ADD. The next step is you want to look at what are called neurovegetative symptoms. I want to know how a person is sleeping, what the nature of onset to sleep is, how long it takes. Do they sustain sleep? Are they rested? Do they wake up with their mouth dry in the morning? I want to look and see if there isn't the possibility of sleep apnea, because bad sleep can mimic ADD in terms of the difficulty to focus. I also get a picture of, is the person having issues with depression? It's the neurovegetative constellation of symptoms that allows us to differentiate that. I want to also next get a detailed past history of treatment. This includes any medication trials, how they responded to them. It includes a potential history of depression, suicide assessment, past, and of course that's in the present if someone comes in for depression. I like to get records before a person even comes in through the door. And sometimes I receive those records and I wind up just shaking my head how, sketchy and incomplete they are. Again, we have what's called a standard of care. And when I think about this, I have some experience doing expert witness work. And when one abides by a standard of care and crosses all the T's and dots all the I's, that's your protection against legal action should a bad outcome occur. So, I always chart and assess with the notion that all of my records will be under the scrutiny of opposing lawyers. So after we get a detailed past history, I want to look at alcohol and drug use. It's a high percentage of people with ADD that at some point check the box for a chemical use disorder. They may not have it when they come through my door, but I want to find out what their history has been. And that's something this doc that Mr. Harbinger went to apparently didn't do, because you want to do a very detailed history. I'm going to do future videos on ADD and addiction. That's worth a deep dive. And if you haven't already signed up to subscribe to this channel, and those things are of interest for you, take a moment now to go ahead and hit the subscribe button. The interesting thing with any sort of stimulant in ADD is often people may have tried cocaine. And they often report, well, it really didn't do much for me. It wasn't like everybody else. And that's because we're dealing with a fundamentally different brain. But I want to know that information. I also look at caffeine use because often people self-medicate with caffeine for their ADD. The next round of things is a thorough family history, both psychiatric and medical. I want to find out where the genetic thread might be for ADD. I want to find out if siblings have it. It's interesting because I treat quite a number of people with bipolar disorder. And one of the really satisfying things, if you know the genetics of bipolar, is to get that domino effect through a family where you can impact other people in a family that you may not even see by having that client get better and then talk to their relatives and get them steered onto the right track of treatment. And I got to tell you, that's really fun to have happen. And that's the importance of getting a really detailed family history. I also want to get a family medical history. I, of course, want to move on to medical history. The issue with ADD medications, if a person has a heart rhythm disturbance, then I want them assessed by a cardiologist. If they're over a certain age, I have them go to their primary care provider and just get me an EKG. I'm a believer in people getting a yearly physical. And that's maybe a whole nother thing to talk about and discuss. But there's lots of stuff that can be hidden. And if you're going to a primary care provider, they should draw blood work. Blood work isn't really all that expensive if you have good insurance. You may pay little to nothing for it, but it can uncover things that may be lurking. And believe me, we all have that potential. I also want to find out if they have allergies. Allergies play an important role in terms of any time you're prescribing anything. You want to know about them. I also look in terms of if they have sort of allergic processes. These tend to be asthma, eczema, chronic rhinitis, and hives. These all bespeak allergic processes. Then I want to do what is called a review of systems. These are basically all the body systems, and there are 11, It includes cardiac, respiratory, urogenital, sexual functioning, skin, neurology. I go through all of that, and that generally is pretty quick, but it's important to know those things. Then I want to move on to what medicines are they taking. Those can have an impact on what you may or may not prescribe. And as much as I prescribe medications, sometimes it's a matter of the best work I do is taking people off them. Oftentimes people sustain a medication. I'll give you a case in point that happened the morning I filmed this interview. I was working up a new client for ADD, and one of his providers started him on Wellbutrin. And this was for his ADD, and it really did nothing for it. And he had known for months, this just isn't doing much for me, but he stayed on it. And sometimes it's having somebody who has the knowledge base to say, hey, let's taper this and get rid of this. I also want to take a really good social history. This allows me to do a deeper dive on what was their childhood experience like? What are the issues that they may have had growing up in their family of origin? And this really comes into play if the person might also be a therapy client. The other aspect that I personally bring to the table is I'm also a trained therapist and have a master's in counseling. And I do that as part of my practice as well. And perhaps that alerts me to think differently, since I often will wear those multiple hats in terms of my work with people. The next phase is formal testing, and that too is a standard of care. And if clinicians aren't doing testing, then they're kind of remiss in meeting that standard of care. My favorite is the Conners Adult Long Form. It is what is called a licensed test instrument. You actually have to verify your academic credentials to be able to access this test, and I pay for the use of this test. There are others, and I will put a list of those in the show notes, that are really pretty good testing. What I like about the Conners is it shows relative degree of symptom along two vectors, the inattentive and the hyperactive vectors of symptomology. We have them take the Conners. I also like to have observer reports, old report cards, but often as adults you just can't get these. And so we have to go on report of childhood history. I invite spouses to come into the session because oftentimes they can give a really good history of, okay, how is the person functioning? And because they live with them and whatnot. ADD has a number of issues with it, and people tend to have more in the way of divorces and whatnot. And oftentimes knowing kind of what the problem is, that the person isn't doing things intentionally, but it gets a relationship back on track too. So this has been an overview of what a good assessment of ADD looks like. And I hope this has been useful for you. If this has been, give this video a like, and absolutely go ahead and subscribe. One of the things that came out of this particular podcast I listened to, and it's a really great podcast, and Jason Harbinger, he totally is there for people. You get it in his replies and some of the really sort of touching things he does with some of the people that he responds to on his call-in. I highly recommend this, and that too will be in the show notes. But I am going to do a deep dive on people's very worst fears about taking stimulant medications. And that's a whole nother program, and it's likely going to be 2 parts. So if that's of interest to you, go ahead and hit subscribe. Until next time, thanks for joining me. Take care, and we'll see you again.